the Right Honourable Member, the Member for Newcastle and Tyne East, and my Right Honourable friend, the Member for Harlow, for securing this really important debate. I'd also like to thank the Backbench Business Committee for allowing this debate. Madam Deputy Speaker, I've been working with young people from Peterborough schools since I was elected on mental health services for children and young people. I'm so lucky to have in my city a group of talented, passionate young people who are ready and willing to offer their time and work with their MP on this important issue. And I can genuinely consider it a privilege to be working with many of these young people. The speech that I'm making today is in part being drafted by those very young people, and they've provided me with quotes, statistics and testimony. So I'd like to thank Daria Robson, Charlotte Humans, Amelia Lawson, Ostea Del and Sam Skeeter and Amira Diani for all that they've done. They've done superb work and they make me proud of Peterborough. It's well documented that there has been an increase in demand for mental health services for children and young people, much of it because of the measures taken to prevent the spread of COVID. A recent survey by the NSPCC reported as many as 67 children a day are helped by Childline for suicidal thoughts. And in my region, the Cambridgeshire and Peterborough Foundation Trust, there were 1,625 urgent referrals in the month of May 2021 alone, of which 795 were potentially life-threatening. We are facing a mental health crisis in our young people, and the more we can support them by providing access to early intervention in the form of in-school counselling, the better things will be. The group of young people that I've been working with have also been working with the Cambridgeshire and Peterborough Clinical Commissioning Group to secure a system with a single point of referral and a new website. And it was this group, Madam Deputy Speaker, who approached me last week to request that I participate in this debate. They asked me to campaign for school-based counselling, which I am more than happy to do. In 2020, and with the first wave of the COVID pandemic, 1 in 6 children aged 5 to 19 were identified as having a probable mental health disorder. This is up from 1 in 9 in the pre-pandemic area. Schools should be one safe place that every child should be able to feel valued, cared for and accepted. School is the perfect place for students who are suffering with their mental health to access an on-site qualified counsellor, because I feel the current systems and mechanisms for mental health provision are not serving young people in the way that they should. In 2019, more than half of GP referrals to child and adolescent mental health services were rejected in the UK on the grounds that their symptoms were not severe enough. And while there are other services being developed, such as the NHS mental health support teams, these are patchy in their coverage and tend to focus on parental interventions. They are no substitute for on-site access to a qualified counsellor. All the evidence supports early intervention to prevent an issue becoming a full-blown crisis, including the research undertaken in my county. School-based counselling can provide an alternative option for young people who have nowhere else to turn. Because the young people that I've been working with have come from a range of schools and colleges, some of which are fortunate enough to have a school-based counsellor and others who are not. Students that benefit from early, easily accessible on-site counselling testify that they feel more comfortable talking with a professional with who they have withstand a long-term relationship due to their presence within the school community. They also emphasise the overwhelming advantage of not missing education time due to leaving school for external appointments for their mental health. A pre-COVID study found that absence due to poor mental health accounted for over 13% of school days lost. Students who have this option are also free from the burden of waiting times, referral lists and possible rejection for not meeting the criteria, and are less likely to need access to emergency services. Providing school-based counselling means that no student slips through the net. However, Madam Deputy Speaker, students from schools and colleges who aren't able to access and offer this service tell a different story. One group I met spoke of only having an access to a trainee counsellor who was limited in the support they were able to provide. This means that students were waiting for a long time to access non-qualified counsellor, only to be signposted to outside organisations. As one student told me, having a qualified counsellor would increase the attendance and engagement of students. More importantly, it would mean that students can get the support they need without having to reach a crisis point before any action is taken. It would mean students felt safer and more willing to seek help, or the help they need without feeling like a burden. This pandemic has put enormous strain on our young people, and I believe we owe it to them to ensure that they have the support that they need at a place where they need it, a school or a college. For this reason, I would urge ministers to listen carefully to the voices of young people in my constituency who come from a variety of schools, the Peterborough School, the King's School, Thomas Deacon's Academy, John Fisher School. Lots of schools in my constituency have taken their time to contact me about this. And please do outline what you're going to do to get more counsellors based in schools.